Chapter 1. The Unseen Terrors of the Roman Street. The air in Rome was a thick, cloying stew of humanity and refuse. Sunlight, when it managed to pierce the dense ochre haze that clung to the city, illuminated a chaotic ballet of life. Street vendors hawked their wares with raucous cries, their stalls overflowing with pungent cheeses, dried figs, and coarse-grained bread. The rumble of wooden cartwheels on uneven cobblestones competed with the bleating of sheep being herded to market and the incessant chatter of 1,000 conversations. Yet, beneath this vibrant, pulsing surface, a more insidious current flowed, a current of unseen dangers, of bodily frailties, and of the ever-present threat of malady. For the average Roman, life was a precarious dance on the edge of disaster. Their homes, often cramped insulae that teetered precariously over narrow alleyways, offered little respite. The stench of unwashed bodies, of stagnant water in communal courtyards, and of waste unceremoniously tossed from windows mingled with the more palatable aromas of cooking fires and incense. Hygiene, as we understand it today, was a luxury few could afford. The grand public baths, marvels of engineering and social hubs, were more about communal ritual and relaxation than a sterile environment for health. While Romans generally valued cleanliness, and their aqueducts and sewage systems were impressive, the sheer density of the population meant that disease could spread like wildfire. In this environment, where a simple scratch could fester into a deadly infection and a cough might signal the onset of a plague, the specter of illness was a constant companion. And when illness struck, when the body betrayed its owner with agonizing pain, relentless fever, or debilitating injury, there was one place to turn and one person to trust, or perhaps to dread, the Roman physician. These were not the clean-robed, sterile figures of modern hospitals. The Roman medicus was a creature of his time, a blend of ancient wisdom, empirical observation, and often a healthy dose of charlatanism. Many were self-taught, their knowledge gleaned from apprenticeships or the scattered writings of Greek masters, themselves often steeped in theory rather than rigorous practice. The most esteemed physicians, like the legendary Galen, gained their knowledge through meticulous study, even dissecting animals to understand anatomy, as human dissection was forbidden. Yet, for the common man, the local physician might be little more than a well-meaning, but perhaps unqualified individual, whose confidence often outstripped his actual skill. The fear associated with these physicians wasn't just about the uncertainty of their cures, it was about the methods. Imagine a world without anesthesia, a world where pain was a given, a constant visceral companion to any significant medical intervention. The surgeon's knife, sharp and glinting under the flickering lamplight, was a tool of last resort, and its passage was accompanied by the unmitigated agony of the patient. The sounds of suffering, the muffled cries, the sharp yelps, the desperate gasps for breath, were as much a part of the surgical theater as the gleaming instruments themselves. Even the tools of the trade were a source of unease: scalpels, forceps, bone saws, drills. These were not the polished, gleaming instruments of today. They were often made of bronze or iron, crudely fashioned, and the concept of true sterilization was rudimentary at best. Boiling instruments in water was a practice, particularly in military hospitals, but its efficacy in preventing the spread of unseen microbes was limited. The surgical rooms themselves were likely far from sterile. perhaps little more than humble spaces within a physician's home or a corner of a bustling barracks, surrounded by the lingering smells of blood, sweat, and desperation. This was the backdrop against which Roman medicine operated, a world of vibrant, yet unsanitary urban life, of profound physical vulnerability, and of medical practitioners who wielded tools and techniques that, without modern understanding, must have seemed both miraculous and terrifying. This is the story of those physicians and the unsettling reality of healing in ancient Rome. Chapter 2: The Physician's Arsenal. Tools of Hope and Horror. The physician's satchel was a Pandora's box, a repository of instruments that promised relief but often delivered pain. For the unfortunate soul seeking the aid of a Roman medicus, the examination itself could be a harrowing experience. Physicians relied on observation, palpation, and the careful examination of bodily fluids. The concept of the four humors, blood, phlegm, yellow bile, and black bile, dominated their understanding of health and illness, with imbalances in these fluids believed to be the root cause of most ailments. Treatments, therefore, often aimed at restoring this supposed balance, frequently through methods that today would be considered barbaric. One of the most common interventions was bloodletting. Cupping vessels, often made of bronze or horn, were used to draw blood, a practice believed to remove excess or corrupt humors. Imagine the chill of the bronze against the skin, the unsettling suction, and the slow, steady ooze of lifeblood, all under the physician's watchful, perhaps impassive, gaze. It was a procedure that could leave a patient weakened, anemic, and vulnerable. But it was a cornerstone of Roman medical practice. For more severe conditions, the surgeon's craft was employed. The array of instruments was surprisingly varied, reflecting a degree of specialized knowledge, particularly within the Roman military where practical experience was abundant. Scalpels with blades of steel or bronze were used for incisions. Forceps of various sizes and shapes were employed to grasp and extract foreign objects or fragments of bone. Bone levers, also known as bone elevators, were used to reposition fractured bones, a process that would have been excruciatingly painful without any form of effective anesthesia. The surgical drill, a rudimentary but crucial tool, was used to bore into bone, particularly the skull. This procedure, known as trepanation, was performed to relieve pressure from head injuries or to remove bone fragments pressing on the brain. The image of a drill, likely operated by a leather thong, whirring into the bone of a conscious patient's skull, is difficult to fathom. To mitigate the heat generated by the friction, the drill would be frequently dipped in water, a small concession to comfort in an otherwise agonizing ordeal. The fact that some trepanned skulls show signs of bone regrowth suggests that some patients survived these procedures, a testament to their resilience or perhaps the surgeon's unexpected skill. Beyond the immediate intervention, Roman physicians had a repertoire of treatments that bordered on the bizarre. Herbal remedies were commonplace, with physicians like Dioscorides compiling extensive pharmacopoeias. While some of these, like the use of poppy juice for its soporific qualities, all had a basis in efficacy, others were more speculative. Unwashed wool was applied to sores, egg yolks prescribed for dysentery, and boiled liver for sore eyes. The belief in the medicinal properties of certain stones worn as amulets also lingered, blurring the lines between rational medicine and ancient superstition. For internal ailments, enemas were a common, if undignified, treatment, administered with a clyster. The scope of Roman surgery was surprisingly broad, encompassing procedures for cataracts, hernias, and even cosmetic enhancements like rhinoplasty. However, these were performed with the same lack of anesthesia that characterized other interventions. The fear a patient must have felt was not just of the potential for a botched procedure or a fatal infection, but of the sheer, unadulterated agony. Without anesthesia, beyond perhaps wine or herbal concoctions that offered minimal relief, the patient was a captive audience to their own torment. The physician's confidence, his practiced hands, and his focused gaze were all that stood between the patient and a descent into unbearable pain. The very instruments designed to heal were, in the hands of the physician and in the vulnerable body of the patient, instruments of profound visceral terror. Chapter 3. The Four Humors and the Bile of Anxiety. The intellectual framework upon which Roman medicine was built was the theory of the four humors, a concept inherited and refined from the Greeks, most notably Hippocrates and later Galen. This theory posited that the human body contained four fundamental fluids: blood, phlegm, yellow bile, and black bile. Health, in this view, was a state of equilibrium, a perfect balance among these humors. Illness, conversely, was a sign of imbalance, or a humoral pathology where one or more of the humors had become excessive or deficient. This humoral theory, while seemingly simplistic to modern eyes, profoundly influenced diagnosis and treatment for centuries. A physician encountering a patient exhibiting symptoms of fever and inflammation might diagnose an excess of blood, leading to bloodletting. If the patient displayed signs of lethargy and a thick complexion, an excess of phlegm might be suspected, prompting treatments to expel it. A person suffering from jaundice was clearly suffering from an overabundance of yellow bile, while melancholic individuals were believed to have too much black bile. The beauty and the terror of this system lay in its pervasive influence and its inherent ambiguity. While it provided a logical structure for understanding the body, the precise diagnosis of humoral imbalance was often subjective. The physician's interpretation of a patient's pallor, the consistency of their stool, or the color of their urine could lead to vastly different conclusions. This subjectivity meant that a physician's confidence in their diagnosis, however misplaced, could have dire consequences. For the patient, this humoral imbalance was not an abstract concept. It manifested in tangible, often frightening ways. A hot and bloody temperament might be associated with aggression and fever, requiring the removal of blood. A cold and phlegmatic individual, prone to sluggishness and congestion, might be treated with emetics and purgatives to clear the perceived excess. The diagnostic process itself was a performance, a meticulous examination of the patient's tongue, pulse, breath, and excretions, all interpreted through the lens of humoral theory. The treatments derived from this theory were equally rooted in its principles. If an excess of yellow bile was suspected, treatments aimed at purging it were employed. This could involve strong emetics, substances that induce vomiting, or potent purgatives, laxatives, designed to expel the offending humor from the bowels. Imagine being forced to ingest a foul-smelling potion, the taste acrid and bile-inducing, its sole purpose to violently expel the contents of your stomach. The relief, if it came, was often secondary to the sheer ordeal. The psychological impact of this theory cannot be overstated. It imbued the body with a volatile, almost capricious nature, constantly teetering on the brink of humoral chaos. Anxiety, a pervasive human emotion, could itself be interpreted as a symptom of an imbalanced humor, particularly black bile. Melancholy, a condition that today we understand through complex neurochemical pathways, was attributed to an excess of this dark, heavy humor. Treatments for such conditions might involve purging, dietary restrictions, or even the application of pungent vapors, all aimed at rebalancing the internal humors. The physician's authority was thus immense, for they were the arbiters of humoral balance. Their pronouncements, based on their interpretation of the patient's internal state, carried the weight of life and death. The patient, often feeling a profound sense of helplessness and internal turmoil, had little recourse but to trust the physician's judgment, even when the proposed remedies were unpleasant, painful, or ultimately ineffective. The fear was not just of the disease, but of the very framework used to understand and treat it, a framework that often led to treatments as alarming as the conditions they sought to cure. Chapter 4. The Surgeon's Table, where pain was the only anesthetic. The Roman operating room was not a sterile sanctuary of healing, but a place of raw, visceral struggle. The concept of germ theory was centuries away, and while some physicians recognized the importance of cleanliness, especially in military settings where infection was a constant threat, true sterilization was an unknown. Instruments, often made of bronze or iron, were typically rinsed or perhaps boiled. But the unseen agents of infection lurked in the air, on the surfaces, and on the hands of the healers themselves. The most profound terror, however, stemmed from the absence of effective anesthesia. Pain was not a side effect of Roman surgery. It was an integral, unavoidable component. Patients undergoing procedures like trepanation, amputation, or the extraction of foreign bodies had no recourse but to endure the searing agony. The physician's aim was to perform the task as efficiently as possible, but the patient's experience was one of unmitigated suffering. Imagine yourself on a crude table, perhaps a simple wooden slab, the air thick with the scent of blood and fear. Your body is held down, not by sophisticated restraints, but by the strong arms of assistants, or perhaps by ropes. The physician, their face a mask of concentration, holds a glinting scalpel. The first cut is a violation. It'll tear through flesh and sinew. A gasp, a choked cry, quickly suppressed by the sheer overwhelming force of the pain. There are no sedatives to dull the senses, no gas to induce unconsciousness. The world narrows to the sharp, unbearable reality of the knife, the saw, the forceps. For bone surgery, the use of a drill was particularly horrifying. The sound of the drill, likely made of metal and operated by a hand crank or a cord, biting into bone, must have been a symphony of terror. As the drill spun, generating heat, it would be frequently dipped in cool water, a gesture of limited mercy. The vibration, the tearing sensation, the pressure, all experienced by a fully conscious patient. The physician's focus was on precision, on removing the diseased bone or relieving pressure, but for the patient, it was an ordeal of unimaginable torment. Amputations were often performed with a searing hot iron, a cauterizing agent used to stem bleeding and, in theory, to seal the wound. The smell of burning flesh, the sizzle, and the accompanying screams were the grim soundtrack to this procedure. While cauterization could prevent fatal blood loss, it was an agonizing process in itself, burning away tissue and muscle. The psychological toll on patients must have been immense. The fear of the procedure itself, the dread of the pain, and the uncertainty of survival were compounded by the very intimacy of the medical encounter. The physician, often a respected member of the community, was also the instrument of extreme physical torment. Patients were often brought to the physician's home or a specialized clinic, where the signs of past surgeries, bloodstains, the lingering smell of disinfectant, perhaps vinegar or wine, and the grim collection of instruments would serve as a stark reminder of what awaited them. Even for less invasive procedures, the discomfort could be significant, and setting a broken bone involved forceful manipulation, often with assistants pulling and twisting to align the fractured ends. A dislocated joint would be wrenched back into place with considerable strength and speed, the sharp pop of relocation accompanied by a wail of pain. The Roman approach to surgery was characterized by a brutal pragmatism. They were skilled in what they could achieve with their limited tools and understanding, particularly in military fields where battlefield injuries demanded immediate attention. Their confidence, honed by experience and a belief in their empirical knowledge, was a necessary shield against the grim realities of their profession. But for the patient, lying exposed and vulnerable on the surgeon's table, that confidence offered little solace against the raw, unanesthetized horror of the knife and the drill. The Roman physician in this context was not merely a healer. They were a necessary evil, a figure of both hope and profound physical dread. Chapter 5. The baths, the brothels, and the bodily fluids. The Roman bathhouse was a marvel of engineering and a cornerstone of daily life. Far from being mere places for hygiene, they were vibrant social centers, places for exercise, relaxation, and conversation. Yet, for all their grandeur and the intricate network of heating systems and pools, they were also, by modern standards, breeding grounds for disease. The communal nature of the baths, us with hundreds of people sharing water and steam rooms, meant that any contagious ailment could spread with alarming speed. Skin infections, from the ubiquitous ringworm to more serious pustular conditions, were common. Physicians, aware of the intimate connection between the body and its environment, often frequented the baths themselves, not just for leisure, but as a means of observing the populace. They would scrutinize patrons, noting their physiques, their skin conditions, and their general demeanor, all in an effort to glean clues about their health. A pale complexion in the steamy heat might suggest anemia, while a rash could indicate a range of ailments, from the mundane to the potentially serious. This constant exposure to the physical realities of the human body, in all its messy and vulnerable states, contributed to the Roman physician's often unflustered approach to bodily fluids. For them, blood, bile, phlegm, or sediment, or inquire in detail about the sediment, or inquire in detail about the consistency and appearance of their stools. This clinical detachment, while necessary for diagnosis, could be deeply unsettling for patients who might feel exposed and embarrassed by such intimate scrutiny. The prevalence of prostitution in Roman society, particularly in urban centers and near military garrisons, also played a role in the medical landscape. While brothels were not necessarily hotbeds of sophisticated medical practice, they were environments where physicians might be called upon to treat sexually transmitted infections, albeit with treatments often derived from empirical observation rather than a deep understanding of disease transmission. The remedies could range from topical applications of various substances to internal purges, thus again reflecting the humoral approach. The physicians themselves, particularly those who served in the military or catered to a wider clientele, were often men of broad experience. They saw the full spectrum of human ailments, from the everyday coughs and colds to the horrific injuries of battle and the slow ravages of chronic disease. This exposure, while hardening them, also fostered a certain confidence, a belief in their ability to diagnose and treat a wide range of conditions. However, this confidence was often based on observation and tradition rather than scientific understanding. The physician's knowledge might be a patchwork of inherited Greek theories, empirical observations, and perhaps a dose of superstition. They understood that the body was a complex machine, but their understanding of its inner workings was limited. This gap between what they could observe and what they could truly comprehend was where much of the terror lay. They were confident in their tools and techniques, but the underlying mechanisms of disease remained largely a mystery, leading to treatments that, while sometimes effective by chance, were often brutal, unpleasant, and based on flawed premises. The physician's role extended beyond mere healing. They were also navigators of the body's complex and often unpleasant realities. Their comfort with bodily fluids, their willingness to delve into the most private aspects of a patient's health, and their often detached demeanor could be deeply unnerving. In a society where physical well-being was constantly threatened by the environment and by disease, the physician was a necessary figure, but one whose methods and understanding, viewed through the lens of our modern knowledge, cast a long and terrifying shadow. Chapter 6. The Military Medic. Survival on the Edge of the Empire. The Roman legions, the formidable engine of empire, were also remarkable mobile hospitals. The sheer scale of Roman military operations meant that injuries and diseases were a constant concern, and the Romans, ever practical, developed sophisticated methods for dealing with them. Military physicians, or medici, were indispensable to the functioning of the legions, and their experiences, often on the front lines of battle and in harsh, unfamiliar climates, shaped a distinct branch of Roman medicine. Within the military encampments, rudimentary hospitals known as valetudinaria were established. These were not the sterile, well-equipped facilities of modern warfare, but functional structures designed to house and treat the wounded and the sick. Here, physicians and their assistants, often drawn from the ranks of experienced soldiers or slaves trained in basic medical care, had worked under immense pressure. The constant influx of casualties from skirmishes, training accidents, and the diseases that inevitably swept through crowded barracks demanded a rapid and efficient approach. The surgical practices in military settings were often more advanced than in civilian life, driven by necessity. Physicians had ample opportunity to practice wound treatment, setting fractures and performing amputations. The application of sutures using linen or gut to close deep wounds was a technique well understood and frequently employed. The importance of cleanliness, particularly in preventing infection in wounds, was also more acutely recognized in the military context. Instruments were likely sterilized through boiling more consistently, and physicians were trained to clean wounds thoroughly with wine or vinegar. However, the reality of battlefield medicine remained grim. Without anesthetics, so the agony of surgical procedures on wounded soldiers was intense. Imagine a legionary, his leg shattered by a barbarian's axe, being carried back to the valetudinarium. The physician's first task might be to assess the damage, a process involving probing the wound with fingers or instruments, a painful exploration of torn flesh and splintered bone. If amputation was deemed necessary, the soldier would be strapped down, his comrades perhaps offering a bracing word or a leather strap to bite down on as the saw bit through bone and the hot iron cauterized the stump, the air filling with the charnel smell of burning flesh and the soldier's involuntary screams. Beyond the immediate trauma of battle, legionaries were susceptible to a host of diseases exacerbated by their living conditions, diet, and exposure to new environments. Dysentery, malaria, and various fevers were rampant. Treatment again followed humoral principles, with bloodletting, purging, and herbal remedies being common. The success rate for many of these interventions was, by modern standards, low, and many soldiers succumbed not to their wounds, but to secondary infections or the debilitating effects of poorly understood illnesses. The military physician's life was one of constant exposure to suffering and death. They witnessed the best and worst of human resilience and fragility. Their confidence was forged in the crucible of necessity, their skills honed by relentless practice. They were pragmatic, often gruff, and accustomed to dealing with the gruesome realities of injury and disease. For the common soldier, their presence was a vital lifeline, but the sheer brutality of the medical care they provided, dictated by the limitations of their time, must have instilled a deep-seated fear. They were the men who dealt with the mangled bodies, the festering wounds, and the agonizing pain, their hands stained with the blood of both friend and foe, their interventions a desperate gamble against overwhelming odds. Chapter 7. Poisons, Potions, and Potent Remedies. The Roman Pharmacopoeia. The Roman Pharmacopoeia was a bewildering concoction of the medicinal and the magical, the empirical and the utterly bizarre. Physicians, armed with their knowledge of herbs, minerals, and animal products, prescribed remedies that ranged from relatively benign concoctions to substances with potent and often dangerous side effects. The humoral theory provided the framework, dictating what humors needed to be purged or strengthened, and the pharmacopoeia provided the means. Herbalism formed the backbone of Roman medicine. Physicians like Pedanius Dioscorides, whose De Materia Medica became a standard text for centuries, cataloged hundreds of plants and their purported medicinal properties. Foxglove, for instance, was known for its effect on the heart, though its precise dosage and application were poorly understood, making it a risky treatment. Poppy, the source of opium, was widely used as a painkiller and sedative, but its use was also fraught with the danger of addiction and overdose. The very effectiveness of these substances, when improperly administered, was a source of potential terror. Animal products were also frequently employed. Honey, with its antiseptic properties, was used to dress wounds. Various animal fats were applied to skin conditions. Snake venom, in carefully diluted forms, was believed to have medicinal properties, or particularly in counteracting other poisons. The liver of certain animals was prescribed for eye ailments, and powdered deer horn was thought to be a tonic. The origins of these ingredients, the methods of preparation, and the precise dosages were often subject to interpretation, leading to potentially unpredictable outcomes. Minerals and metals also found their way into Roman remedies. Lead compounds were used in ointments, despite their known toxicity. Antimony, a metal with emetic properties, was used to induce vomiting. The powdered lapis lazuli was a component in some eye treatments. The belief that certain minerals held inherent medicinal power, often linked to astrological or symbolic associations, further complicated their use. The preparation of these remedies was often a messy olfactory assault. Mortars and pestles would grind herbs and roots, releasing pungent aromas. Alchemists and apothecaries would boil, distill, and macerate ingredients, thus creating foul-smelling poultices and viscous liquids. The final potions could be bitter, acrid, or otherwise unpleasant to taste, a testament to the efficacy of their ingredients rather than their palatability. The physician's role in prescribing these remedies was crucial. They had to assess the patient's humoral balance, determine the appropriate treatment, and then prescribe the correct medication. This involved a deep understanding of the pharmacopoeia, a skill that varied greatly among practitioners. The charlatan, eager to impress, might prescribe overly strong or unnecessary remedies, while the more cautious physician might undertreat, allowing a condition to worsen. The terror lay not just in the unpleasantness of some of these remedies, but in their potential for harm. Without precise measurements and a deep understanding of pharmacology, even seemingly benign substances could prove toxic. The reliance on empirical observation meant that efficacy was often judged by anecdotal evidence rather than controlled study. A remedy that worked for one person might be disastrous for another. The Roman pharmacopoeia, therefore, was a double-edged sword, a source of genuine relief in some instances, but also a potent arsenal of potentially dangerous substances wielded by physicians whose knowledge, while extensive for their time, was ultimately incomplete. Chapter 8. The Mind and the Malady. Psychiatry in Ancient Rome. The concept of mental illness in ancient Rome was as intertwined with humoral theory and spiritual beliefs as any other ailment. There was no clear distinction between the physical and the psychological. A troubled mind was often seen as a manifestation of an imbalance in the body's humors, or the result of divine displeasure, or even demonic possession. This complex interplay of factors made the treatment of mental afflictions a particularly frightening prospect for those afflicted. Conditions we would now classify as depression, anxiety, or psychosis were often grouped under the umbrella term melancholia. This was frequently attributed to an excess of black bile, the heaviest and coldest of the humors. Treatments aimed at rebalancing this humor were therefore paramount. This could involve purging through strong laxatives or emetics, bloodletting, or dietary changes designed to lighten the patient's disposition. Imagine being subjected to violent physical expulsions when already feeling low and listless, a treatment that could only exacerbate feelings of weakness and despair. For more agitated or violent states, physicians might resort to more drastic measures. Restraint was common, with patients confined to dark rooms or even shackled to prevent harm to themselves or others. And the application of cold compresses or baths was also employed, a shock to the system intended to calm a turbulent mind. The use of sedatives, primarily derived from opium, was also a recourse, but its unpredictable nature and potential for addiction made it a dangerous tool. Supernatural explanations for mental illness were also prevalent. Diseases of the mind were sometimes seen as punishments from the gods or the work of malevolent spirits. This led to treatments that involved rituals, as prayers, and even exorcisms. Physicians might consult with haruspices, divinas, or perform rites to appease offended deities, blurring the lines between medical practice and religious ceremony. The fear of divine retribution added another layer of terror to the already frightening experience of mental distress. Galen, the most influential physician of the Roman era, did recognize the role of the brain and nerves in mental disorders, a significant step forward. He understood that damage to the brain could cause various symptoms, including loss of speech or memory. However, his understanding of neurological function was still rudimentary, and his treatments for these conditions often remained within the confines of humoral theory. The social stigma attached to mental illness also contributed to the fear. Those suffering from visible or disruptive mental conditions were often ostracized, feared, or relegated to the fringes of society. Their treatment, all when it occurred, was often conducted in private, away from the public eye, further isolating them and amplifying their sense of dread. The physician dealing with a patient exhibiting signs of mental distress faced a unique challenge. They had to contend with the limitations of their understanding, the often harsh treatments dictated by humoral theory, and the pervasive belief in supernatural causes. The patient, already suffering from profound internal turmoil, was subjected to interventions that could be physically debilitating, psychologically distressing, and ultimately ineffective. The Roman approach to the mind and its maladies, while containing glimpses of rational observation, was largely steeped in a fear of the unknown, a fear that was often projected onto the patient through treatments that were as terrifying as the conditions they sought to cure. Chapter 9. The Oculist's Glance. Preserving Sight in a World of Darkness. The preservation of sight was a major concern in ancient Rome, where eye ailments were common and often debilitating. Without the sophisticated diagnostic tools and sterile surgical techniques of today, the work of Roman oculists was a precarious endeavor, fraught with the potential for both miraculous recovery and catastrophic blindness. The fear of losing one's sight, a fundamental sense, lent a particular gravity to the treatments offered. Roman physicians recognized a wide range of eye conditions, from common infections and inflammations to more complex issues like cataracts and pterygia, fleshy growths on the eye. Their diagnostic methods relied heavily on visual inspection, a skill honed through years of practice. They would carefully examine the eye, noting the redness, swelling, discharge, and any opacities or growths present. Treatments varied depending on the perceived cause. For infections and inflammations, a variety of eye washes and salves were prescribed. These could be made from herbal infusions, mineral solutions, or even animal products. Honey, known for its mild antiseptic properties, was a common ingredient. Rosewater was used to soothe irritation. Lead compounds, despite their toxicity, were also incorporated into some eye ointments, perhaps for their astringent properties. The application of these substances, often via an eyedropper or a medicated cloth, could be uncomfortable, and there was always the risk of introducing further infection. The most dramatic and terrifying intervention in Roman ophthalmology was the treatment of cataracts. Cataracts, which cause the lens of the eye to become opaque and impair vision, were treated through a procedure known as couching. This involved using a needle-like instrument to dislodge the clouded lens and push it to the back of the eye, allowing light to pass through again. Imagine the scene. The patient is seated, instructed to remain perfectly still. The oculist, their hand steady, holds a sharp, slender instrument. With extreme precision and a deep breath, they introduce the needle into the eye, aiming to displace the opaque lens without causing further damage. There was no anesthesia. Were immense. Hemorrhage, infection, and were immense. Hemorrhage, infection, and further damage to the eye were all potential outcomes. A failed procedure could result in permanent blindness, a fate often worse than the original impaired vision. The physician's skill was paramount, but even the most experienced oculist could not entirely overcome the limitations of their tools and the inherent risks of operating on such a delicate organ. The fear associated with Roman ophthalmology was amplified by the fragility of the eye and the irreversible nature of blindness. For patients seeking treatment, there was a desperate hope for restored vision, but also a profound dread of the procedure itself and the potential for permanent loss. The oculist, in their quiet, focused manner, best wielded a power that could either grant the miracle of sight or plunge their patient into an eternal darkness, a choice that rested on a needle's point and the steadiness of a surgeon's hand. Chapter 10. The Gynecologist and the Gynecological Ordeal. The health and reproductive capacity of women were central to Roman society, and the physician specializing in women's health, often referred to as a gynecologus, played a vital role. However, the medical understanding of female anatomy and physiology was limited, and the treatments offered for gynecological issues and childbirth could be fraught with danger and discomfort. The intimate nature of these conditions, combined with the primitive medical practices, made for a terrifying experience for many Roman women. Gynecological examinations themselves were likely conducted with a degree of modesty, but the internal examinations, if necessary, would have been performed with fingers or specula, crude instruments designed to open the vaginal canal for examination. These examinations were performed without the benefit of sterile gloves or lubricants that we use today, increasing the risk of infection. For issues like menstrual irregularities, infertility, or vaginal discharge, treatments often involved the use of pessaries, solid or semi-solid medicinal preparations inserted into the vagina. These could be made from a variety of substances, including honey, herbs, and animal fats, intended to soothe, cleanse, or deliver medicinal properties directly to the affected area. The effectiveness of these remedies was questionable, and the insertion of unsterilized materials carried a significant risk of infection. Childbirth was perhaps the most dangerous period for Roman women, and the role of the attending physician or midwife was crucial. While many births were attended by women within the family, complications often necessitated medical intervention. The physician would rely on observation and palpation to assess the progress of labor. Internal examinations were performed to check the dilation of the cervix and the position of the baby. If labor was prolonged or difficult, physicians might resort to manual interventions to try and reposition the baby or assist in its delivery. This could involve forceful manipulation within the birth canal, a painful and potentially damaging process for both mother and child. Instruments like obstetric forceps, while known, were not widely used, and their design was rudimentary, and making their application risky. In cases of fetal distress or maternal exhaustion, the physician might consider embryotomy, the dismemberment of the fetus within the womb, to facilitate its extraction. This was a procedure of last resort, performed when a vaginal birth was impossible and the mother's life was in danger. The thought of such a procedure performed without adequate anesthesia or understanding of asepsis is deeply unsettling. It represented a brutal confrontation with the limits of medical intervention, a choice between two terrible outcomes. Postpartum complications, such as hemorrhage or infection, were also a significant threat. Treatments for these conditions often involve the use of astringent douches or topical applications, again with limited efficacy and a risk of infection. The fear for Roman women seeking gynecological care or undergoing childbirth stemmed from a confluence of factors: the mystery surrounding their reproductive health, the primitive nature of the instruments and treatments, the lack of anesthesia, and the high mortality rates associated with childbirth. The physician, while intended to be a source of aid, could also be the agent of suffering or even death. Their interventions a desperate gamble in the face of formidable biological challenges. Chapter 11. The Barber Surgeon: Hairs, Hives, and Hacking. In ancient Rome, the lines between professions were often blurred, and this was particularly true in the realm of health and personal grooming. The barber, or tonsure, was not just concerned with cutting hair and shaving beards. Many also possessed the basic surgical skills to perform minor procedures. This barber surgeon, a figure common throughout history, represented a more accessible, yet often less refined, a form of medical intervention for the average Roman. Barbers were the first point of contact for many minor ailments. Their shops, often located in bustling public areas, were centers of gossip and commerce, but also places where one might seek relief from a nagging itch, a painful ingrown toenail, or a troublesome wart. Their toolkits, while including combs and razors, also contained sharp knives and cauterizing irons. Their surgical repertoire was limited but practical. They were adept at lancing boils and abscesses, draining pus, and removing superficial foreign objects from the skin. They might also perform circumcisions, a procedure common for various cultural and religious reasons, and at times for perceived health benefits. Setting minor fractures, like those of the fingers or toes, might also fall within their purview. The fear associated with the barber surgeon stemmed from several factors. Firstly, their training was often informal or acquired through apprenticeship rather than rigorous medical education. While some barbers might have had a knack for surgical tasks, others were likely less skilled, their procedures rough and ready. Secondly, the lack of hygiene was a pervasive issue. The same razor used to shave a dozen customers might be used with only a cursory wipe to make an incision. Instruments were not meticulously sterilized, and the risk of transmitting infections, from minor skin conditions to more serious diseases, was significant. A seemingly simple procedure like lancing a boil could inadvertently lead to a life-threatening infection if the barber's instruments were not clean. Cauterization was a common method used by barbers to stop bleeding or to treat certain skin lesions. This involved applying a hot iron to the affected area, a painful procedure that, while effective in sealing wounds, was intensely uncomfortable. The smell of burning flesh and the sharp cries of the patient were the grim accompaniments to these interventions. For the average Roman, seeking the services of a barber surgeon was often a matter of convenience and cost. They were more readily available and less expensive than a fully trained physician. However, this accessibility came at a price. The risk of infection, the lack of sophisticated diagnostic skills, and the often brutal nature of the procedures. The barber surgeon, with their sharp blades and hot irons, represented a more accessible, yet perhaps more frightening, encounter with the medical world, a constant reminder that even minor ailments could carry significant risks. Chapter 12. Veterinary Medicine, the Animal Kingdom's Torments. The Roman world was deeply intertwined with animals. Horses, oxen, dogs, and livestock were essential for agriculture, transport, warfare, and companionship. Consequently, there was a practical need for veterinary care, and Roman writers, including Columella and Vegetius, documented various methods for treating animal ailments. While their focus was on preserving the utility and well-being of animals, the treatments described reveal a pragmatic and at times unsettling approach to animal health that mirrored, in some ways, the practices applied to humans. Veterinary physicians, though less documented than their human counterparts, existed, and their practices were often based on empirical observation and inherited knowledge. For common ailments like lameness in horses or digestive issues in cattle, treatments involved a range of herbal remedies, dietary adjustments, and manual interventions. Wound care was a significant aspect of veterinary medicine. Horses injured in battle or accidents required prompt attention. Physicians would clean wounds, remove foreign bodies, and apply bandages, often using similar materials and techniques as those used for humans. For severe injuries, amputation might be considered for livestock, particularly if the animal could still be of some use post-surgery, a testament to the economic realities of animal husbandry. Surgical procedures on animals, much like on humans, were performed without anesthesia. Setting fractures in large animals would have been a physically demanding task, requiring strong assistance to restrain the animal, while the bone was manipulated into alignment. The pain experienced by the animal would have been considerable, though the human observer's empathy might have been tempered by the animal's economic or practical value. The use of cauterization was also prevalent in veterinary medicine, employed to stop bleeding from wounds or to treat certain skin conditions. The application of hot irons to a struggling, terrified animal must have been a harrowing spectacle. Diseases affecting livestock, such as the lung sickness in cattle or rabies in dogs, were treated with a variety of remedies. These could include purging with purgative plants, administering concoctions of herbs and minerals, or applying external treatments to the affected areas. The effectiveness of these treatments was often limited, and widespread outbreaks could decimate herds, posing a significant economic threat. The Roman approach to veterinary medicine, while practical and often ingenious for its time, highlights the limited understanding of animal physiology and disease. The treatments, though aimed at healing, often involve procedures that would be considered cruel by modern standards, lacking the consideration for animal welfare that we now expect. The physician or veterinarian, while skilled in managing animal health, was still operating within a paradigm where pain and discomfort were often unavoidable consequences of treatment, a grim reality that extended even to the animal kingdom. Chapter 13. The Physician as Magician. Charms, amulets, and the supernatural. While Roman physicians prided themselves on their rational approach to medicine, the boundaries between science, superstition, and magic were often blurred. For many Romans, illness was not solely a physical affliction, but could also be influenced by supernatural forces, curses, or the will of the gods. Consequently, physicians often incorporated elements of magic and ritual into their treatments, either out of genuine belief or as a means of providing comfort and hope to their patients in the face of the unknown. The belief in the power of amulets and charms was widespread. Physicians might prescribe specific stones worn in a particular way to ward off illness or to treat specific conditions. For example, amber was believed to be effective against throat ailments, while amethyst was thought to prevent drunkenness and ensure clarity of mind. These talismans were often inscribed with protective symbols or incantations intended to invoke divine protection or to neutralize malevolent influences. The use of incantations and magical formulas was another common practice. Physicians might recite specific verses or prayers over a patient or over a remedy before administering it, believing that the spoken word held power to influence the body and the course of the disease. These incantations often invoked deities, spirits, or cosmic forces, all seeking their intervention in the healing process. The concept of sympathetic magic, the belief that like effects like, also played a role. For instance, a remedy for a skin condition might involve using an ingredient that resembled the affected part of the body, or a charm might be crafted to represent the illness and then destroyed, symbolically eliminating the disease. For conditions that resisted conventional treatment or those with unclear origins, physicians might suggest or even perform rituals. These could range from simple blessings to more elaborate ceremonies involving sacrifices or offerings. The physician, in such instances, was acting not just as a healer, but as an intermediary between the patient and the divine or spiritual realm. The fear associated with this aspect of Roman medicine lay in its inherent ambiguity. While some patients might find solace in these magical practices, others might be further terrified by the implication that their illness was beyond the realm of natural causes, subject to forces they could not comprehend or control. The physician's invocation of magic, while intended to help, could also amplify the sense of vulnerability and the fear of the unknown. The physician who dabbled in magic whether out of necessity or conviction, walked a fine line. They were trusted for their medical knowledge, but when they turned to charms and incantations, they entered a domain where the line between healer and sorcerer became perilously thin. For the patient, caught between the physical suffering of their ailment and the bewildering forces of the supernatural, the physician's magical interventions, however well-intentioned, could be a source of profound and disquieting fear. Chapter 14. The Legacy of Fear. Roman Medicine's Enduring Shadow. The medical practices of ancient Rome, viewed through the lens of modern understanding, are a stark reminder of how far we have come in our quest to alleviate human suffering. The reliance on humoral theory, the absence of anesthesia and sterile techniques, and the incorporation of superstitious beliefs all contributed to a medical landscape that was, for the patient, often terrifying. The constant threat of infection, the excruciating pain of surgery, and the often unpleasant or ineffective nature of treatments meant that seeking medical help was a gamble. Patients placed their lives and their well-being in the hands of physicians whose knowledge, while often extensive for their era, was ultimately limited by the scientific understanding of the time. The physician's confidence, their practiced hands, and their sophisticated instruments were a source of hope, but also a stark symbol of the risks involved. The legacy of this era is not one of simple condemnation, but of profound understanding. The Romans, through their empirical observations and their relentless pursuit of knowledge, laid the groundwork for much of Western medicine. Figures like Galen, despite their theoretical limitations, made significant contributions to anatomy, physiology, and surgical techniques. The development of public health infrastructure, the establishment of military hospitals, and the cataloging of medicinal substances were all crucial advancements. However, the terror that permeated the Roman medical experience cannot be ignored. It serves as a powerful testament to the human capacity for endurance in the face of unimaginable pain and uncertainty. It underscores the importance of scientific progress, the ethical imperative of minimizing suffering, and the constant need for humility in the face of the vast mysteries of the human body. The stories of Roman patients, their agonizing surgeries, their dubious remedies, and their desperate pleas for healing echo through the ages. They remind us that the pursuit of health has always been a journey fraught with peril, and that the physicians who navigated these treacherous waters, though often terrifying in their methods, were nonetheless essential figures in the ongoing struggle against disease and mortality. Their legacy is a complex tapestry woven with threads of innovation, pragmatism, and, undeniably, a pervasive and deeply human fear. Chapter 15. Whispers in the Blood. The Unseen Echoes of Roman Healing. Even as the great empire waned and new eras dawned, the echoes of Roman medical practices reverberated through the centuries. The fear instilled by the Roman physician was not easily erased. It lingered in the folk remedies passed down through generations, in the cautious hesitation before a barber surgeon's knife, and in the hushed discussions of humoral imbalances that persisted long after Galen's writings were translated and debated. The very foundations of Roman medicine, its reliance on observation, its systematic approach to cataloging ailments and remedies, and its pragmatic engagement with surgical challenges provided a bedrock upon which later medical advancements would be built. Yet, the methods employed, born of necessity and limited understanding, cast a long shadow. The image of the physician, not as a sterile scientist, but as a sometimes brutal practitioner, a magician, a barber, or a soldier with a blade, remained etched in the collective memory. The absence of true anesthesia meant that the visceral memory of pain associated with medical intervention became a deeply ingrained part of the human experience. Even as anesthetics were slowly developed, the historical weight of centuries of unanesthetized suffering created a psychological barrier, a lingering fear that modern medicine would eventually overcome, but never entirely forget. The terrors of Roman medicine were not merely physical, they were psychological, spiritual, and societal. The fear of the unknown, the fear of divine retribution, the fear of bodily betrayal, and the fear of the very hands that sought to heal, all combined to create an atmosphere where seeking medical help was often an act of profound bravery. Today, as we step into sterile hospitals, benefiting from the marvels of modern medicine, it is essential to remember the struggles of those who came before us. The Roman physician, with all their terrifying methods, was a product of their time, a testament to the human drive to understand and conquer illness. Their story is a vital chapter in the ongoing narrative of healing, a narrative that continues to unfold, forever shaped by the lessons learned from the unsettling, yet undeniably compelling world of ancient Roman medicine. The whispers of their practices, the memory of their unsettling interventions, serve as a constant reminder of our progress and a somber acknowledgment of the suffering that paved the way for the healing we so often take for granted.